Okay, so my this video is on parotid gland. Okay, it is the largest of the three pair of salivary glands. So there are three salivary glands. One is parotid gland, submandibular gland, sublingual gland. The largest of all three of this is the largest one is parotid gland. The location is retromandibular fossa. Okay, it lies in retromandibular fossa, and then the boundaries of this are anteriorly it is bounded by posterior border of ramus of mandible. Okay, anteriorly by the posterior border of ramus of mandible, posterior border of ramus of mandible, posteriorly by mastoid process, superiorly by external acoustic meatus, and medially by styloid process. Okay, so medially by styloid process, anteriorly by ramus of mandible, posteriorly by mastoid process, and superiorly by the external acoustic meatus. Okay, now the parotid capsule, which we have already learned in the investing layer of deep cervical fascia, that the investing layer of deep cervical fascia, when it is traced vertically upwards, it encloses two glands, submandibular and parotid gland. One of them is parotid gland, and then it splits into two layers. Okay, a superficial layer and a deep layer. The superficial layer is also called parotidomesenteric fascia, and the deep layer is also present, and the superficial fascia presents with a thickening, and it forms stylomandibular ligament. What? Stylomandibular ligament. The superficial layer or the parotidomesenteric fascia, it is attached to the tympanic plate, whereas the deep layer is attached to the zygomatic arch. Okay, now next is there is I'm going to tell you about one of the clinical correlation, that is infection of the parotid gland, like in mumps and all. Mumps virus, the commonly affected gland is parotid gland, and inflammation and swelling of this gland occurs. This causes severe pain. Okay, and I will be doing the external features of the parotid gland in detail in the next video, but I will give you a gist of, okay, how are you going to remember this? See, first of all, this is a three-sided pyramid, okay, where the apex is directed downwards. So this is the apex, this is the base region, okay, and this is how the pyramid is somewhat. Okay, this is how the pyramid is, and the surfaces, there is an apex, there are four surfaces and three borders: anterior, posterior, medial border, four surfaces. Base is included as one of the surface: superficial surface, anteromedial surface, posteromedial surface, and base. Okay, superficial, anteromedial, posteromedial, base, and then anterior border, posterior border, and medial border. So these are the boundaries. I'll tell you about apex and the base, which is very simple. You need to draw this diagram first. This is the parotid gland. The apex, from the apex, the structures passing are anterior and posterior division of retromandibular vein and the cervical branch of facial nerve. Cervical branch of facial nerve. So this whole is the structures that is emerging from the apex. Now from the base, this auriculotemporal nerves and vessels, superficial temporal vein and artery, superficial temporal vein and artery, and auriculotemporal nerve. Now from posterior border, so see, this is the posterior border, posterior auricular nerves and vessels. In my next video, I will be doing difficult ones.